This presentation is for academic and training purpose only. It does not make anybody a professional expert. Do not go ahead with opinion making and medication. You must understand it is not allowed for any uncertified person for medical practice by law. Yearly once we have a first aid training program, so those who are interested may join in for the same. This will be a certificate program and this is a live session, so whatever you are going to listen is only for academic purpose. This is a video for those who missed our free physiology and psychological first aid certificate program. I understand that sometimes time doesn't permit us to join into activities we want to do, so here it is. And in this video I will be briefing you about the workshop topic. But for this certificate you either need to mail me or WhatsApp me, and we can go for a very quick online assessment to find out your understanding. So let us begin now. So the first topic that we are going to discuss is a small definition of first aid. So what is first aid actually? First aid is a temporary and immediate treatment given to the patient or the survivor of an accident or sudden illness before a certified help arrives. So where is this first aid done? First aid can be done at any place of crisis or disaster like accident or earthquake, etc. It can be done at refugee camps, ambulance, and also places in community where we observe the need for immediate medical help. So why do we need first aid? First aid helps us to save life of injured. It helps us to reduce the pain and anxiety. This provides a temporary help, and it also helps us to reduce the impact of the injury in a long run. So let us understand some principles of first aid. A person who is giving first aid has to act quickly with a stable mind. Care provider has to act with maturity, and he or she needs to be with the patient till the time a medical help is received. While giving first aid, one must not hurry while treating the patient. It can lead to further injuries. Okay, so we have to be patient and we have to be relaxed. We should not be tensed. We should not go under a panic attack or something. Also, one very important thing is like we should not do it just for the sake of doing it. Okay, we should be honest with what we are doing. One very important principle is like you have to examine the breathing of the person, whether the person is bleeding excessively or the survivor is having any other issues. So this is called ABC. We will be seeing it later. We must ask the person or the survivor that what they need immediately to calm themselves down. Like somebody would be needing a pill or an inhaler which they might be carrying in their pockets. Someone might need water. Others might find relaxation by calling their family members for help. So it depends upon person to person what they need and how they calm themselves down. So we must go ahead and ask them. So by now we have understood who are the beneficiaries of first aid. The beneficiaries of the first aid, of course, are the survivor or the injured. But during an accident or during a disaster, not everybody needs a first aid. We have to identify people who need immediate and urgent attention, and we must go to them immediately for help. There was one very interesting question during the session. One person asked, how much will we be paid, for this physiological or psychological first aid? So first of all, whether it is physiological first aid or is it psychological first aid, it has to be free of cost. Okay, anyone who is expecting something like gold chain or any reward and getting the injured person reach hospital, I would say it is very not only selfish, but it is very inhuman also, right? So our first responsibility as an individual, is to provide help for another individual. This is our duty. Each individual should help others when there is a requirement without expecting too much, let this be free of cost. There are few golden rules of first aid. First is, like, we have to be quick to reach the survivor, and we should have the ability to analyze the injuries. We will be learning it in detail, and we will understand how we can address and analyze the situation. The second thing is, like, we have to be very quick to reach for medical help. Immediately we must approach someone like a doctor or a hospital or any camp for help. Okay, and during the first aid session, do not ask unnecessary questions to the survivor. Just let it be an easy talk with them, and only ask essential things, like for example, if somebody is injured, ask where the injury is and other details about the family, and don't go and ask for details like what is your qualification and things like that. This is not relevant there. So when you provide support, and you must check the level of consciousness of the person, whether the person is oriented or not. Now you have to observe the airway of the survivor or the patient. Okay, you can ask verbally whether this person is facing any kind of breathing difficulty. Once you do that, you can check for blood circulation in the body. You can look for injuries. Blood circulation, we will be going through the topic later. There is an artery near the neck. We can check it from that place. Also, there are other methods in which we can check, and also you can see the pulse, general pulse and all that. Okay, so when you are providing first aid, especially to small children, okay, you should not take them away from their parents. Let them be with their parents. If we do that, it is a psychological comfort for them, and there will be less impact on them later. Now we have to make sure that we reach a relief camp or a hospital as soon as possible. Another important question that we must ask them is that whether they are on any medication, and if they are on medication, what kind of a disease they have, and some kind of a detail that we can present it in the hospital or to the person, to a doctor. During such accidents, especially road accident and all that, there will be a lot of crowd around the survivor. So make sure there is this crowd is removed, and the person has a lot of space where he or she can breathe easily. Now we have to understand where the pain is, whether the head has been injured, whether there is a fracture in the body. We will be doing this all, we'll be learning about all this later also. So we have to understand, and we have to identify some flags, where we have to be careful while handling this person, and we cannot rush in for treatment. We have to be patient, calm, steady. So this is the introduction part, and let us now look at the first topic of the day. This is psychological first aid. So what is psychological first aid?